Hi, I'm Dr. Tony Mork, author, speaker, and endoscopic spine specialist. Today I'd like to talk about a novel treatment of cervical facet syndrome. This is a problem that can be chronic and really doesn't have much of a definitive type of treatment, usually just either injections or the rhizotomy. Today I'd like to talk a little bit about the results of that paper published in 2010 and also an adaptation to the surgery that I have done with the Wolf interlaminar surgical scope. The main shortcoming of current treatments being conservative are that the injections and radiofrequency only usually last between 6 and 9 or 6 and 12 months before they have to be repeated. The paper I published back in 2010 had a 3-year follow-up with 77% good to excellent results at that point in time, which I thought was pretty good. To replace the 14mm tube I was using back in 2010 and before, I used the 8mm interlaminar scope, which I became familiar with in Germany in this past year when addressing L5S1 disc issues, period. I felt that the endoscope was large enough to pass instrumentation through, particularly a burr to address osteophytes. The concept of the operation was really debriding the capsule of the facet joint all the way posteriorly so that the end plate receptors were removed in this process, as is the synovium that may be getting pinched in a facet syndrome situation. The ablation can also take place as far laterally as the dorsal nerve root innervation occurs into the capsule. And I think that this is really, you're just essentially removing the nerve supply as well as the end plate receptor area for the capsule of the facet joints. As you know, people are always looking for a definitive treatment to a problem rather than an intermittent treatment. And I think that economically speaking, to perform one procedure definitively is much better than repeating the current type of treatment, which is occurring on an annual basis. At this point, I'd like to show you what it looks like. Thanks for watching. If you've got any comments or would like some more information, please contact me at the office or on the website. Thank you.